Hi and welcome to Mr. Edwards' GCSE PE revision sessions. These videos give you the option to pause, freeze and rewind the lessons at your own pace. Classification of joints and the movement possible at different joints. By the end of this video, you'll be able to identify the 4 main joint classifications and the 8 types of movement possible at different joints. You should be able to explain the 4 main joint classifications and the different movement types and the range of movements possible. Finally, you should be able to apply your knowledge of the joint classifications and the movement to a range of tasks and questions. Joint classification. Key term. A joint is defined as a place where 2 or more bones meet. Bones are rigid, so it allows the presence of a joint that allows movement to occur. Most joints in the human body are freely movable or synovial joints. Synovial joints share lots of common features. However, they are classified according to their structure and the range of movement that is allowed. The 4 main joint classifications are pivot joint, ball and socket joint, hinge joint, and condyloid joint. Pivot joint, this is found at the atlas or axis of the top of the neck and allows your head to turn left and right. Ball and socket joint, this is found in the hip and the shoulder. Hinge joint, this is found at the elbow, knee and ankle, and condyloid joint, this is found in your wrist. Types of movement. Key term, movement types, names used to identify direction of movement at a joint. While most sporting actions require a combination of movement of many joints simultaneously, it is possible to isolate specific joint actions. The different movements at joints on a name for the sporting actions can be described and analysed. When looking at joints, those that can perform many different movement types are seen as having a large range of movement, while those restricted to a low number of movements are considered to have a low range of movement. The 8 different types of movements are flexion, rotation, extension, circumduction, abduction, dorsiflexion, adduction, and plantar flexion. Flexion and extension. Flexion. Flexion is where the angle at the joint is decreased. Flexion occurs when bending at a hinge joint or a condyloid joint. It can also be seen when a limb moves in a forward direction at a ball and socket joint. For example, if you were flexing your muscles to show off your guns, the upward movement is a flexion. A sporting example would be a bicep curl on the upward phase of the bicep curl. Extension. Extension is where the angle at the joint is increased. Extension occurs when straightening a hinge joint or a condyloid joint. It can also be seen when limbs move in a backwards direction at a ball and socket joint. An example is after you've flexed your muscles and you've shown off your guns and you lower your arm back the other way. This is extending the hinge joint in your elbow. Sporting example is the downward phase of the bicep curl. Abduction and adduction. Abduction. Abduction is where the limb moves away from the midpoint of the body. Adduction only occurs at a ball and socket joint and condyloid joints. For example, during star jumps, the upward phase is abduction because you're taking away from the midpoint. A sporting example of this would be throwing a baseball, a cricket ball, or a rounders ball. As you can see here, the athlete's arm has been abducted away from his body. Adduction. Adduction is where the limb moves back towards the midpoint of the body. Adduction only occurs at ball and socket joints and condyloid joints. This would be the downwards phase of a star jump. A sporting example of this would be taking a penalty in hockey. As you can see, the athlete's arms and the hockey sticks are adducting, so they're moving towards the center point of her body as she hits the ball. Rotation and circumduction. Rotation is a twisting action where parts of the body twist around its long axes. Rotation only occurs pivot joints, ball and socket joints. An example of this will be turning left or right. A sporting example would be a gymnast performing a routine which involved rotating. For example, a twist or a flip within the air. Circumduction. Circumduction is a combination of flexion, adduction and abduction, and extension. Circumduction movements look like you're drawing a circle in the air. Circumduction only occurs at ball and socket joints and condyloid joints. A sporting example of this would be butterfly in swimming. An example of this will be rotating your hands in a circle with your arm extended. Dorsiflexion and plantar flexion. Dorsiflexion is when the toes are raised towards the shins in an upward motion. Dorsiflexion only occurs at the ankle in the hinge joint. If you raise your foot up and down, the upward movement is dorsiflexion. A sporting example of this would be when you're running or walking, when your foot is moving in an upward direction. As we can see from this power walker here, his left leg or his left ankle is dorsiflexed. Plantar flexion. Plantar flexion is when the toes are pointed away from the shin downwards, and plantar flexion only occurs at the ankle and the hinge joint. This is the downward phase of moving your foot. So if you lift your foot up on the way back down, you are plantar flexing it. A sporting example of this would be the athlete here as they're pushing away from the blocks. You can see that his left leg is plantar flexed and his front leg, so his right leg, is dorsiflexed because it's moving up towards his shin and his back foot is moving away from his shin. Ligaments and tendons. During movements, two connective tissues play a very important role at the joint. Ligaments connect bone to bone and hold the joint together. They are tough and slightly elasticated. They help to prevent dislocations. A dislocation happens when a bone is forced out of place. Tendons. Tendons connect muscle to bone, and tendons ensure that when a muscle contracts, the effort is transferred to the bone and a movement is created. The tendons allow movement to happen, and the ligaments prevent the movement going too far and dislocating the joint. Thank you for listening to Mr. Edwards' GCSE PE revision videos. If you have any questions, feel free to email me on damianedwards@kingselbarsha.com. Cheers, bye.